Good morning, this is Steve from IDD Therapy, Disc Clinics. I've just been driving into work today, and all the way here I've been thinking about a social media conversation I had yesterday. And this relates to someone who messaged me. They had just completed a course of IDD therapy for a cervical disc problem, and the treatment hadn't worked, or they hadn't got improvement. And they'd made an investment. It had cost them about £1,100, and they were obviously not happy. And they were saying, I don't know how you're going to expect to get this in the NHS when this treatment hasn't worked. And I don't like to hear when the treatment isn't successful, and I take those quite personally. Although I know that the clinician has given their all to try to help that patient. The patient had been explained to them that there's no guarantees with the treatment. They had had a variety of different treatments before they'd come to the IDD therapy. They had been looked at for surgery, but they didn't have weakness in their arm, so they'd been discounted to have surgery. So this was a difficult patient who had not finished a complete course of IDD therapy, but they'd had treatment and it hadn't improved them. They got disc degeneration for quite a few years of the neck pain. I kind of, once I'd got over I'm saddened. I don't like to hear about the negatives because we hear a lot of positives. But the reality is that what would this patient's options have been? If they had gone down, had some injections, how much would that have cost them? And what would have been the long-term pain solution or pain relief from the injections? If they'd gone down, if they had some surgery on the neck, that would have cost, I don't know, £15,000, maybe more if they're having a disc replacement, and a very, a major operation. Now, those treatments don't have 100% success rate. Every treatment has its place, and we just have this expectation, I think, that somehow, somewhere there is like one solution which is going to somehow miraculously address this chronic back pain issue that we have. So once I'd kind of analysed it and thought about it, I did go back to the guy, and I was sorry. I said, I'm really sorry to hear that you've gone down this course of treatment and it's not worked for you. Does that mean that this treatment is a failure? If we were turning back the clock and doing the same, would we have done the same thing? Yes. With hindsight, when it hasn't worked, then it's easy to say, well, that was a complete waste of money. I should never have done that, da-da-da. The guy still has the pain, and he's not made the improvements that he was after. Does that mean that we shouldn't have tried? What about all the people that it does work for? This obviously, it creates quite a bit of turmoil in my head when I hear these things. But the reality is that there is no one size fits all. The manual therapy, when someone doesn't come back from manual therapy, it doesn't always mean that patient is better. It means that a lot of them have still got pain and they've gone somewhere else. When somebody goes to see a consultant, then that they might have some injections, they might have surgery, but most are leaving that consultant, and most of those patients who see a consultant have already had some form of manual therapy, and then they're going back into the system where the options are pretty much the same, and that's where the IDD therapy comes in. Now, of those people, there are going to be some that don't respond, and those people that don't respond may well end up going to see a surgeon, and the surgeon says, well, you've tried IDD therapy, that doesn't work, because here's somebody it hasn't worked for. But that's kind of ignoring the fact that all the other people that it does benefit. So I explained this to him. I wonder what answer I'm going to get, because I'm sure he's thinking, I've just spent £1,100 and this hasn't worked, I want my money back. But equally, for every injection or multiple injections, people don't ask for their money back. It's like, we're trying this, there's no guarantee, but we're doing it with good faith, hopefully, that it's going to have a positive outcome. So this, I was just kind of troubled by it, and I thought, well, I tend to put things out there about the positives about IDD therapy, but the reality is it's not going to work for every patient, and I don't want to hide away from that. Yes, I want to present the positives, but there are going to be people that it doesn't work for. That's frustrating, and we can only try and get insights and think about, okay, why in that particular case didn't it work as well as we would like it to, or not at all, and what might we do differently next time with such a patient. And that's progress, I hope. So just sharing a few thoughts, yeah, a little kind of rant in my car as I come into the office today. So anyway, have a good day, and if you want any information about IDD, let me know. If you've seen patients it hasn't worked for, keep an open mind, please, about the patients that it is working for. That's kind of what's driving the network. So have a good day, and thanks for watching.